Joining us now to talk about that and more as well is Dr. Russell Faust, the Medical Director of the Oakland County Health Division, with us once again on the MegaCast. Dr. Faust, thank you for being with us.
Tyler, hello again. Thanks for welcoming me. Thanks for the introduction.
Absolutely. So let's start with where we're at in the COVID-19 pandemic, because from December 20th to the 2nd of January of this year, Oakland County's had the highest surge in COVID-19 cases that's had since the pandemic began, over 21,000 cases. So just where are we at, particularly in Oakland County, but really across the board at this point in the pandemic, with the Omicron variant being much more transmissible, albeit maybe not producing as severe of symptoms as the Delta variant?
Yeah, well, I'm glad we're starting with the bad news, because that is bad news. In the last month, we have literally doubled the number of cases that we see on a daily basis here in Oakland County. And, you know, that's, I don't think that's unique. That's pretty well statewide and pretty well nationwide. I suspect that represents the high infectious Omicron variant, although we need to understand that identifying the Omicron variant requires genomic sequencing. So when we have positives here based on our PCR or antigen testing, we send those to state, and they take anywhere from when we swab to getting the result back upwards of 2 weeks. And so we're usually a couple weeks behind based on how fast Omicron transmits. It's likely higher, more widespread than we know at, today. So we won't know for a couple weeks. Right now, the number that we're getting back from state is about, so this is from 2 weeks ago, right? Or more. The number is Omicron makes up about 2% here in Oakland County of the positive cases. The fact is, because of that enormous surge in number of cases, we suspect that most of those are now Omicron, and we'll know in a couple weeks.
We're joined by Dr. Russell Faust, the Medical Director of the Oakland County Health Division, joining us on the MegaCast. On a wider scale, because the Omicron variant is spreading rapidly, not only here in Oakland County and throughout the state of Michigan, but around the U.S. and around the world, we have seen reports in other places that Omicron the Omicron cases have not been as severe as cases of the Delta variant or others. Is that something that we're finding to be the commonality of this? And with that being the case, if that is the case, then how does that impact our approach going forward from a public health standpoint? Because there's going to be greater spread. You would presume there's going to be greater spread because it's more transmissible, but the threat of severe symptoms may not be as severe.
Well, there are a lot of variables in that answer. That is, right now we have far more people vaccinated than we have had in the past, say when we're looking at Delta data. We're well over 70% across all populations here in Oakland County, and some populations over 90% vaccinated. So it's difficult to answer that question, but let me just say that you're correct. Around the world and in other jurisdictions that have experience, they're fairly well saturated with Omicron, they're reporting a less severe clinical picture. Now, what I don't want to do is give the idea that folks shouldn't get vaccinated because this is no big deal. This is still a big deal. That is, the number of people that are being hospitalized is enormous. All of our hospitals are saturated right now. Many are above census. That is, their emergency departments are in so-called overflow, where they have beds in the hallway or even people on ventilators that are in the emergency department, not up in the ICU where they really should be. So let's not downplay the severity of this Omicron wave. However, I need to stress that if you're fully vaccinated plus have had your booster, your immunity to even Omicron is optimized. And we really need to get that message out. Everybody needs to be optimized, maximize your immunity. Because even if Omicron won't be the last variant for SARS-CoV-2. There are more coming. Every active infection generates more mutations. Every active infection produces more variants. And if those variants have mutations through, for example, the spike protein, the higher your immune level, the more of the antigenic sites you recognize on spike protein, the more likely you are to remain healthy when you do become infected with Omicron or the next variant. And right now, if you're maximally vaccinated, even if you get infected, a so-called breakthrough, it will keep you healthy, out of the hospital, off a ventilator, and alive. And the vast majority of people that are being hospitalized due to COVID-19 infections right now are unvaccinated. And that was the case 6 months ago. It's still the case. I check on, I call around to the hospitals in county on a fairly regular basis here and ask that question. The folks that have breakthrough infections, that is, are fully vaccinated and boosted, who are hospitalized, fall into basically one big category, that is, they're elderly with comorbidities, or the other category is they're immunocompromised, either from disease process or from medications treating disease. So the vast majority, again, are unvaccinated.
We're joined by Dr. Russell Faust. He is the medical director of the Oakland County Health Division, joining us on the MegaCast. You can learn more information about the spread of COVID-19 as well as COVID-19 resources, precautionary measures that you can take at your business, at your home, and out in the community, as well as information on getting vaccinated, as well as your booster shots by going to civiccentertv.com and clicking on our Oakland County link on our coronavirus page. That's civiccentertv.com/coronavirus. Right at the top of the page. We have links to Oakland County, the state of Michigan, and the CDC resources. And so, Dr. Faust, we continue to get reports from our hospital systems of their continued overwhelming battle with COVID-19 and the ways that it's not only affecting treatment of COVID-19 in their hospitals, but of other acute medical issues or severe medical issues like heart attack or stroke or major injuries or even minor injuries that come into their ERs or come in other ways. And what we're also seeing now, especially with the more highly transmissible Omicron variant being in play, is more hospital employees are having to leave the space because they become infected or they themselves become ill due to COVID-19. Just today, we had a report from the Detroit Free Press. Beaumont Health, 430 of its 33,000 staff are out. Spectrum Health on the west side of the state, 766 of its 31,000 staffers. Henry Ford, also locally here in Metro Detroit, 989 or 3% of its roughly 30,000 employees are out. So with that being the case, more people in the hospitals because of COVID-19 and because of other issues, people unable in those cases, while these hospitals are being pragmatic about taking care of the most present issue being COVID-19 and those most severe health issues. And then on top of that, having hospital employees, medical officials that are on these front lines also having to bow out because of COVID-19. Just how much more severe of a situation does the spread of more highly transmissible variants like Omicron or maybe others that will come along after Omicron, how much more of a strain does that put on our public health systems and our private health systems' abilities to prevent this pandemic from becoming more deadly than it already has been?
So in other words, just how bad is it?
Yeah.
How bad will it become? It is bad right now. I will say this though. We met on this topic nearly 2 years ago now, Tyler. Yeah. I didn't think we'd be here having this conversation 2 years later. But the good news is that compared to a year ago, say, or a year and a half ago, right now when folks need to be hospitalized for COVID-19 complications, the hospitals are so much better at managing them. That is, your risk of fatality is less than half of what it was a year and a half ago. That is, we have medications now. We have the monoclonal antibodies that are still effective. We have vaccines that are keeping people healthier. We have various oral antiviral medications now that are being pushed out. So, I think that's the good news. I did want to kind of branch off on emphasizing this one thing. The fact that so many people, especially in, well, everybody, but it's affecting our hospitals, our healthcare systems, our staff are becoming infected. The fact is, they're not becoming infected while they're wearing masks on the job. They're becoming infected when they're out and about. Now, I'm sure you've recognized this when you're out of the store. You may be the only one in a mask. I certainly am when I'm out with my family, and we'll be the only ones in a large store in a mask aside from the employees who are required to mask. Masks work regardless of what variant we're discussing here. That is, masks still work for Omicron. Masks work. Distance still works. You know, we've learned enough. There are no big secrets here. There's no rocket science involved here. We know we have the tools to keep everybody healthy. We've got great vaccines, boosters. We've got monoclonal antibodies and oral antivirals, but we have masks, and these will always work. And, you know, I will say this. There are some things being circulated on, I won't name the sites, but social media right now saying that cloth masks and surgical masks no longer are effective, and that's absolutely false. They're very effective, 70 to 80% protective. So people need to mask, get everybody vaccinated, and we'll all be safer and we'll get through this pandemic.
We're joined by Dr. Russell Faust. He is the medical director of the Oakland County Health Division, joining us on the MegaCast. And so, yeah, I wanted to touch on the mask situation, because we have heard, we have seen those reports come in. As you mentioned, that the reports that certain kinds of masks that we've been using, cloth masks, surgical masks, are ineffective, are false. But we have heard other reports that while those masks are better than nothing, particularly with the Omicron variant, that other masks such as KN95 or N95 masks may be better at preventing the spread of the Omicron variant. Is that the case? And if so, why with this variant is there that difference?
So, this variant and all SARS-CoV-2 variants are transmitted by respiratory droplets. That hasn't changed. The physical size and shape of the virus hasn't changed. So all the variants are still transmitted physically in the same way. However, some of the variants are better at infecting people and better at increasing blood levels of virus, so the level of virus that we shed is higher. But they're still transmitted by respiratory droplets, meaning masks are still effective. Now, with regard to the types of masks, surgical masks, surgical masks, actually there we go, and cloth masks, these are still very effective. 70 to 80% protective. N95s and KN95s are 90+% protective. They're just certainly not as comfortable to wear as a plain surgical mask or a multi-layer cloth mask. But masks are very protective. That's the number one tool that we have: masks, distance, vaccination.
Well, Dr. Faust, we appreciate having you on. Anything else that we should be keeping in mind on the COVID-19 front going forward at this moment in time?
Yeah, we're still testing here at Oakland County. We're still vaccinating. November and December, we were out vaccinating children at the schools. We were in 15 different schools. Folks that are interested in being tested or being vaccinated, call our nurse on call number 800-848-5533. Thanks so much, Tyler.